So looking at the next complication in pregnancy, we look at Bell's palsy. So Bell's palsy is a nervous system issue. Okay, it's a nervous system issue where your muscles on the cheek gets to like paralyze. Okay, so if you don't want to say cheek, you say your facial muscles gets to paralyze. So it can actually happen in pregnancy. Right, so let's look at rare situations. So Bell's palsy in pregnancy is a temporal weakness or paralysis of the facial muscles. Do you understand? All right, you can see this woman, she kind of like is it this side or is this side? Yeah. This was when she's kind of like healing, this was when the thing was kind of like high, so it occurs more frequently in pregnant women, especially in the third trimester, or maybe if they just give birth, you have these complications. So why it happens? Hormonal shifts. All right, these are possible reasons. We're not saying all of them must happen at once. Do you understand? Possible reasons, any could happen. Fluid retention, your immune system is what? Suppressed. Do you understand? All right, pregnancy may compress or inflame the facial nerve. Okay, sorry. If there are hormonal shifts, fluid retention, immune suppression, all of this may lead to like issues with the facial nerve. Do you understand? That's the cranial nerve 7, right? So also preeclampsia, that's like hypertension in pregnancy. HELLP syndrome, that's hemolysis, elevated liver enzymes, low platelets. All of them could lead to issues with the facial nerve. Okay, reactivation of herpes simplex virus, that means the woman formerly had herpes simplex virus. So in pregnancy, her immune system became weak, so the infection now showed up. Do you understand? These are all possible reasons. We are not saying one person must have all of this, So symptoms is what? She's having facial drooping. Yeah. All right. She's having difficulties with smiling. She's having difficulties with blinking. She's having difficulties with speaking clearly. She has a dry eye, or she's tearing excessively. There's loss of taste or facial sensation. There's ringing in one ear or headache. Hypersensitivity to sound on that side that's affected. Okay, so diagnosis and treatment is often clinical, right? So you want to rule out stroke. You want to actually be very, very sure that that person doesn't have stroke. Do you understand? Then steroids may be used cautiously. That's the treatment. Okay, diagnosis, you're just trying to do all those imagings to make sure that okay, it's a facial nerve that is affected, there's no stroke. You understand? Then you are doing blood tests, to pick up if there was any hormonal shift or fluid retention. You understand, that kind of thing. So also physical therapy, where they just do facial massage for the person, facial exercises. So recovery is possible, because one of the things is it is pregnancy that is causing the issue. So once you give birth, the issue is going away because there's no pregnancy again. Okay, so that's it for Bell's palsy in pregnancy.